Hello everyone and welcome to our online blood pressure advice session today. It's great that so many of you have joined us, and I hope that you will all benefit and find today's information useful that is given during today's session. My name is Hannah and I am the Community Health Promotion Manager at Northern Ireland Chest, Heart and Stroke. And I will start off our session today by providing you with some brief information just about our charity and why we are running the blood pressure advice session as part of our blood pressure campaign. But before I do so, I'd like to give a really warm welcome to our panel, Dr. Aaron Peace, Dr. Naoimh White and Vanessa McMinn. And thank you so much for taking the time out of your busy schedules to support our campaign by attending today's session and offering your advice on the topic of blood pressure. So firstly, I'll ask you to introduce yourselves if that's okay. Vanessa, would you like to start off?
Yes, thank you very much for inviting me today. I'm Vanessa McMinn and I'm a dietitian with over 23 years of experience of working within the NHS, primarily in diabetes and heart health, but I'm currently a public health dietitian within the Southern Health and Social Care Trust.
Perfect, thank you so much. Dr. Aaron Peace.
Hi, thanks for the invite as well. I'm Aaron Peace. I'm one of the cardiologists here in the Western Trust, and I suppose I look after blood pressure every day of the week, and even when I'm off, like this week. And so I have a background as well of being the Director of Research and Development in the Trust here in the Western Trust. And so we'd be involved in a lot of new treatments for treating high blood pressure in particular.
Perfect, thank you so much. And finally, Dr. Naoimh White.
Thank you, Hannah. Yes, my name is Naoimh White. I'm a GP in Belfast and work both in South Belfast and North Belfast. I've been a GP for nearly 20 years. And I have done a recent project within our GP practice with the support of Chest, Heart and Stroke, where we've been able to give patients our own home blood pressure monitoring equipment. And we've been able to diagnose a significant amount of patients who may be on significant waiting lists. So happy to be here. Thank you.
Perfect. Thank you so much, everyone. So before we start our advice session today, I just wanted to give you some information about the work that we do as a charity. And our aim is to prevent chest, heart and stroke conditions by helping people from all ages and all walks of life across Northern Ireland to make healthier choices and to protect their health then for the future. And we do this through delivering our services and working with others, including health and government bodies, to support you to make health changes. And we do this in a number of ways, firstly through our research. And since 1994, we have invested nearly £8 million into local research. We also, through our prevention work, whether by adopting a healthier lifestyle through our wide range of health promotion programs or getting a health check with us, we are working to prevent people becoming ill in the first place. We deliver evidence-based health promotion programs in workplaces, schools and communities, and we deliver workshops, talks and also health checks to ensure that you make sure that you look after your health and well-being. We also lobby the government to support changes, as we know that there are certain factors outside of your control, such as maybe income and housing, that can impact on our health and the choices that we make in life. And our care and support team also support those who have unfortunately suffered from a chest, heart or stroke conditions, and also support their carers as well. So if you or a loved one have already had an existing condition and would like some extra support, please do not hesitate to get in contact with us. And nearly 90% of our work relies on the generous donations from you, the general public, supported by our fundraising team. And I want to thank you all for joining today and supporting our work, as without that support, we wouldn't be able to continue to provide the range of services to help you to look after your health and well-being for the future. So why are we running this blood pressure campaign? Well, high blood pressure, or hypertension as it's also known, if untreated, can increase your risk of serious problems such as heart attacks and strokes. And one of the main messages we want to get across today is that high blood pressure is linked to 1 in 2 heart attacks and strokes. And our campaign focuses on the slogan, his numbers up or her numbers up, focusing on the painful or fatal consequences of high blood pressures with the numbers counting the cost. And over 280,000 people in Northern Ireland are living with high blood pressure. That's 15% of the population. And 1 in 2 adults don't know they have high blood pressure. So we're not only wanting to warn people of the danger of high blood pressure, but we are urging everyone to have their blood pressure checked regularly. And we're very grateful to Mace, who is our campaign partner, who has helped to fund this campaign. And as part of the campaign, we are raising awareness, delivering blood pressure health checks and organising events like today's advice session. We also have some blood pressure checks running throughout the next couple of weeks where you can drop in and get a free blood pressure check. For example, today we're at the Mace store in Green Island. So if you want to pop down this afternoon, you can get a free blood pressure check until 3 o'clock. We're also in Mace in Warringstown on the 7th of June, in Ard Shopping Centre in Newton Ards on the 8th of June. We're in the Mace in the Moy on the 13th of June and in Bloomfield Shopping Centre in Bangor on the 15th of June. And please do visit our website for further information on our campaign and the timings of those health checks. And you can access more information on blood pressure and health related information, as I say, on our website or as well on our social media platforms. So as I say, we're delighted to be holding this online blood pressure advice session today as part of our campaign and giving you the opportunity to give you some information and access to health professionals who can answer some of your questions about blood pressure. So thank you so much to those of you who have asked questions during the booking process, and we'll be looking at those now in our session. So without further ado, Vanessa, I'm going to come to you first, if that's okay. And can you just firstly, for everybody here, just explain what is blood pressure, and what are those levels that we should be within to have a normal high blood pressure, or to have a normal blood pressure reading?
Okay, well, so blood pressure is the measure of the work our heart has to do to pump blood around the body. And whenever you get your blood pressure measured, you'll always be given it as 2 numbers. For example, somebody might be told their blood pressure is 120/80. But to understand what those numbers mean, I always think of your heart being like a pump. So I have a pump here. So the 120, which is the large number, normally sits at the top. That's the force or the work your heart has to do to push that blood around the body, but then it has to fill back up. So that's the 80. So the 80 is when your heart's filling back up to push it out again. So that'd be 80, 120. So it's the work that your body has to do in order to pump the blood around. Blood pressure, 120/80 is pretty much gold standard. Anything above 140/90 would be considered high. But I have to stress that anybody with certain medical conditions, they might have their own unique blood pressure targets to stick to, but that's in essence is what blood pressure is.
Perfect. Thank you so much, Vanessa. And Dr. Ironpiece, what is the risk of high blood pressure to other conditions? I briefly mentioned there can increase the risk of the likes of heart attacks and strokes. Why does high blood pressure cause that?
Well, I mean, high blood pressure causes a whole variety of things. It can have an impact on your kidneys, can have an impact on your brain, can have an impact on your heart. And so those are all the things that we look for whenever we're looking at high blood pressure. But it's like any sort of engine. If you look at your body as an engine, if you have high pressure within the system, then it causes damage. And it's something that we see so frequently, and it's something that is very insidious. And I think that that's one of the real sort of most important things to understand about it. That people really most of the time don't actually know that they have high blood pressure, and that's why it's so important to actually look for it, because it's something that we can actually manage so well and so easily. There are lots of major risk factors, including smoking and high cholesterol and diabetes and people having low levels of physical activity or being overweight or obese. And, you know, people actually tend to focus an awful lot on family history, but which is important, obviously, but it's one of these risk factors that unfortunately at this minute in time, we can't really change. You know, it's, you know, we're born and we have certain genetics that we inherit, not all of us, but some of us. And so it's really important that, you know, the public at large and practitioners that look after blood pressure focus upon the things that we can actually change. And that's where, you know, we have to, as you said before, you know, high blood pressure is one of the most sort of preventable causes of heart disease and stroke and indeed death, in actual fact. So, you know, it's really important for us to focus on the things that we can change, focus on the risks that we can reduce. And in the case of high blood pressure, that's something that our GP colleagues and us in secondary care should really focus on, and the public at large should really find it important to try and lower their blood pressure by whatever means.
Perfect. And we'll be discussing that later on in our session today about ways that we can reduce our blood pressure. And you mentioned there around lifestyle factors, and that leads us on really nicely, Vanessa, to, you know, in terms of our diet, is there anything in particular that we can do to help reduce the risk of high blood pressure?
Very much so. There's a number of things that we can look at in the diet to help to lower blood pressure. The first one would definitely be the salt intake. So if you've got high blood pressure, we really do encourage people to reduce their salt intake. So trying not to use salt, or use a lot less of it during cooking, using herbs, spices, pepper, and try not to use salt at all at the dinner table. But interestingly, 70% of our salt intake actually comes from processed meats, things like your bacon, your sausages, or salty snacks like crisps and nuts, but also from eating out. So if people want to reduce their salt intake, we would be saying to, you know, to reduce the processed meats, the processed foods, try to eat out less, make their own home cooked takeaways, and try to reduce their snacks or their processed food snacks. The other big thing for helping to reduce your blood pressure is really looking at the message of increasing your fruit and your vegetables and trying to aim for that 5 or more portions per day. The actual 5 a day message is closely linked to stroke prevention. That's where the 5 a day message came from. So people try to always make sure they've got vegetables, or a good plate of salad or vegetables at each meal, and then maybe replace some of these processed snacks with maybe fruit instead. It's a really easy way to meet their 5 a day. The other thing would be to try and encourage people to go for the whole grain, starchy carbohydrate foods, and then look at the type of fat that's in their diet. So moving away from the animal types of fat and your saturated fats, which would also include your coconut oil and your palm oil. So moving away from those saturated fats and replacing those with the unsaturated fats, such as your olive oil, your rapeseed oil, or your corn oil, because they're much more heart protective. There's also a link between caffeine and high blood pressure. So it's trying to reduce people's caffeine intake to no more than 3 caffeinated drinks per day. And then also alcohol intake. So we all know that the more alcohol we take, the higher the risk of high blood pressure. The 2 best diets to look at if you're wanting to make the dietary changes to reduce your blood pressure would be the Mediterranean style diet, or there's the DASH diet. But for anybody who wants a wee bit more information on a healthy balanced diet, there's also the healthy eating section of your own website, the Northern Ireland Chest, Heart and Stroke. But there's also a lovely suite of nutrition webinars available on the Public Health Dietitian's YouTube channel. The one I'd direct you to would be the Healthy Diet, Healthier You, for so much more information on how to actually make those individual changes.
Brilliant. And we'll be following up this webinar today with a little email with some of these links that we're signposting you on to today. So don't be worrying about if you can't remember where some of the support resources are. We'll send you all those as well. And sometimes we always think about what food we're eating, but we forget actually what we're drinking as well can have a major impact, the likes of our tea and coffee there. So that's really good to remember as well. And Dr. White, there was a question that came in about, is our systolic worse than having high diastolic? You know, is high systolic worse than having a high diastolic blood pressure reading? If the other one is normal, in terms of those 2 numbers, the top and the bottom number, is there a difference, or does it matter in terms of the 2 numbers and where they sit?
Well, we often see some of them, one can be up and not the other one, but we would treat them both the same. If only got one reading up the same as both. We used to think in the past one would have been more concerning than the other, but really if any of them are up, that needs to be looked at. You can have just systolic hypertension, which is quite common, when just the systolic blood pressure is up and the diastolic figures are normal. So your systolic would be over 140, but your diastolic would be less than 90. But we would still treat that as hypertension. And we would try and treat it within target. So again, it depends on certain diseases that patients may have. So if you're diabetic or if you have kidney disease, your targets would be a bit lower. Or also you'd also take into consider age. So we would probably try and be a bit more aggressive if you're much younger. Whereas older patients may be more prone to side effects of medications, and they may tolerate slightly higher blood pressure, maybe 150, depending on their age and their other health issues. But yeah, so we would target both of the figures.
Perfect. And just following on from that, Dr. Aaron, is there any way that, is there any different types of ways that we lower, for example, our systolic blood pressure? Dr. Naoimh there was saying about there is a certain thing called systolic hypertension. Is there a specific way that we can lower if a certain one is high, or is it just general, the lifestyle advice that we'll be mentioning now in a moment to help lower both of those numbers?
Yeah, I think it's very difficult, as Naoimh was saying, we don't really have targeted therapies that just, target the top line, which is the systolic blood pressure, or the bottom line, which is the diastolic blood pressure. I mean, it's not uncommon when you're treating high blood pressure that people's diastolic pressure remains high, particularly as they're older, because diastolic pressure is generated by the pressure that's maintained within your circulation. And so as you get older, the compliance in your circulation gets a bit more stiff. And so it's actually can be quite difficult to lower it. But I think really in general, people have to realize that blood pressure medications that we use, or lifestyle modification, such as increased exercise and weight loss, those things tend to target both your systolic and diastolic blood pressure. And unfortunately, really at this time, there's very little that you can do that's going to really lower your diastolic blood pressure, specifically.
No, that's great. And I suppose moving on then, we're chatting there about treating high blood pressure. And Vanessa, is it always necessary to go on medication whenever your blood pressure is high? And if so, if you go on medication, does that mean you're on it for life?
Well, I'd very much take the lead on that from the doctor or the consultant. If somebody's required to take a blood pressure medication, I would always be encouraging them to take it. Now, if the person does have a substantial amount of dietary changes and lifestyle changes that they want to make, I would say, yes, you stay on your medication and make those changes. Like, for example, eating more fruit and veg, getting out for more exercise, just tidying up the diet as in general. If the blood pressure does come down significantly, I would never tell anybody to stop their medication. It's where I would say go and have a discussion with your consultant or your doctor, because blood pressure is only one thing that we look at if we're managing a medical condition, so that there could be so many other protective effects of the medication. So I would definitely put the two together. Now, if you've got a family history and you haven't as yet been started on medication, I would say yes, definitely start all the preventative things first, like your diet, your exercise, not smoking. If you carry a bit of extra weight, trying to get that down to try and help limit or reduce your risk of progressing progressing to high blood pressure.
Absolutely. And that point there about going off, the advice of your health professional, like your GP, so important in regards to medication. Continue on it until you're otherwise advised, and continue monitoring your blood pressure if you are making those lifestyle changes, to see if they are actually having a positive impact on helping to lower it. And I suppose, Aaron, in terms of that, leads us on to how much control do we have in terms of maintaining our blood pressure at a healthy level? We've been mentioning there around, family history, if we have family history, or some of those other factors, that we are out of our control. Who is more at risk at having high blood pressure?
Well, I think that what we're seeing now, I mean, there's a huge percentage of the population, in particular, who are overweight and obese, you know, so, and I mean, that's something that was predicted 50 years ago, and it's really come to pass now that I'm sure that in general practice in particular, you would see a huge amount of people who are overweight. I think it can't be underemphasized that, you know, lots of people out there, they don't really want to be taking medications. You know, people will often come into you and say, look, I don't like taking tablets, doctor. And there's very few people that do, you know, but I think that what Vanessa's saying is, you know, key in all of this here, because in actual fact, you know, people probably, you know, arguably the most common reason why people have high blood pressure nowadays is purely down to their weight. And it's actually, and you know, there's lots of cases nowadays where people, if they lose significant weight for using by whatever means, they find that their blood pressure normalizes, and indeed, in some cases they're no longer considered diabetics because their blood sugars are normal and they don't require any medications, you know. So I just think that if there's a take-home message in all of this, you know, we don't really want to be prescribing medications unless they're absolutely necessary. But I think the general public have the opportunity to really not take medications if they make a concerted effort to lose weight.
Yeah, so definitely around lifestyle changes, you know, it can have a really positive impact in terms of helping to lower that blood pressure. And obviously there is things, you know, as we get older, as, you know, I think Naoimh, you had mentioned about, you know, the risk of high blood pressure may increase, family history a wee bit, but lifestyle plays such a major role in helping to reduce it, no matter what age and our situation is. And Vanessa, we've touched briefly on some of those different lifestyle changes you know, that we can implement to help lower our blood pressure, and you'd given us some great advice there around diet. Can you give us any more specific advice around some of those other topic areas you'd mentioned around like physical activity and all? What other areas can we implement in our lifestyle to help lower our blood pressure?
Physical activity is one of the big ones. And really, at the very essence, we just try to get people to move more. So anybody who has those watches that count the steps, if you're only doing 2,000 steps a day, let's get up to 4,000 and then get up to 5. But the real aim would be trying to get up to your 150 minutes every week of moderate intensity exercise, or your 75 minutes of vigorous exercise. But on top of that, doing our strength exercises just to work all the muscles in the body. So basically just moving more and trying to sit less, no matter how, whatever way you need to move more, whether it be just standing up, taking a phone, or walking around, taking a phone call, getting up to move or to change the channel rather than sitting down. So just moving more, sitting less. The other big one is very much looking at smoking. So if anybody smokes, we would be strongly recommending that they would stop smoking. There's lots of smoking cessation services available within each trust area. And then looking as well at alcohol intake. So if anybody doesn't drink, we never recommend that they start. But if they do drink alcohol, it's really trying to bring them down to those no more than 14 units per week, with at least 2 or 3 alcohol-free days per week, just to try to keep within the safe limits. But then going right back to what Dr. Peace had said, very much it's to do with obesity. So if we make a lot of these diet and exercise and not eating out as often, reducing our alcohol intake, if we make these dietary changes, it's very unlikely your weight's going to go up. It's much more likely that you'll be able to manage the weight. So, but even if the weight doesn't come down, still make these changes, because they're still going to be heart protective. But I would be very surprised if by making the changes that it wouldn't have some positive impact on the lifestyle.
Yeah, and sometimes we can try to do too much at the one time, and then it seems overwhelming, and we can sometimes then go back to square one in terms of, you know, trying to make positive changes. And it really is so important, isn't it, to just do those simple steps, like you say, you know, if you're on the phone, get up, have a bit of a walk while you're on it. Or I always say to people, when they're watching their favorite program, get up in the ad breaks and do a few armchair exercises or something. And it is really important to just start off slowly, you know, and build it up and start off small, and even choose one thing from today's session of the advice that you guys are given, you know, and try and implement that into the changes in your lifestyle. And once you've achieved that, then moving on to something else, so it's more sustainable sustainable. No, that's great. And as I say, all of that information of those, guidelines and everything, they're on our website as well. So please do have a wee look at that and to help you remember just what we should be trying to do in terms of a nice healthy lifestyle. And Dr. White, in terms of, we've been saying there about really important to check our blood pressure. How often should we be checking our blood pressure?
Okay, yeah, I was going to pick up another point just about the diagnosis of high blood pressure. So us in primary care, we've loads of different people who are monitoring blood pressures and checking blood pressure. So we have the nurse and we've also specialist pharmacists who manage hypertension. But we also examine a patient if they have a new diagnosis of hypertension, because you can get other causes for high blood pressure. So for example, if you're young and your blood pressure is high, we would need to double check there's no kidney disease and heart problems. But we also look to see at the time of diagnosis, is there actual any signs to suggest the blood pressure is causing strain on the body? So sometimes we would look at the back of the eye. Sometimes we would get a heart tracing to see if there's any strain in the heart. So that's one of the first things we do when we diagnose high blood pressure. We also need to make sure it's not caused by something else. So like a kidney problem, more likely if that was diagnosed as a young person, but also somebody if their blood pressure is high and it's not coming down with the standard treatment. Some people need 3 to 4 tablets to be on to control blood pressure. Then if it's still not being controlled and we can't get it down, at that stage we would maybe need to consider, actually, is there another cause for this high blood pressure? So I thought it would just be important just to clarify that sometimes there are other causes for high blood pressure. In regards to how often we should do it, so NICE recommends, that's the National Institute for Clinical Excellence, they recommend every 5 years. In my experience, patients tend to come in and diagnosed high blood pressure or a high blood pressure reading picked up opportunistically. So sometimes they're worried or stressed and we check a blood pressure and it's high, or they may have symptoms that they're worried about, palpitations, for example, or they may be concerned that there's a family history of high blood pressure and they sometimes come in and get the blood pressure taken. So a lot of the time it's opportunistic because most people don't get symptoms of high blood pressure. So even though NICE say every 5 years, and if your blood pressure is okay, once after one-off reading and you've been told that you don't have high blood pressure, they do recommend every 5 years. But I suppose I would err on the side of caution in regard to 5 years. That does seem like quite a long time. But if there's a stronger family history, or if there's a history of heart attacks or strokes in the family, or if somebody's quite overweight, I would probably recommend getting the blood pressure checked even sooner than every 5 years.
And as well as we get older, probably as well, Naoimh, would we need to check it a wee bit more regularly too? Is there a certain age bracket that you'd recommend people maybe get it checked a wee bit more regularly?
Again, it depends on other issues or medical problems there may be. So for example, patients with diabetes, we would check at least every year. Patients with significant mental health issues on certain medications, we would try and check at least every year. But the guidance doesn't specifically say anything, but annually would certainly be reasonable.
Okay, and I'm throwing this one in here for you, Naoimh, because you mentioned there about there are different causes. It's not just about your lifestyle, that can cause high blood pressure. But a question did come in there about, does having an underactive thyroid cause high blood pressure? Would that be another possibility that could be causing it?
So underactive tends to cause low blood pressure, lethargy, and low blood pressure. Although practically, I don't often see that. Hyperthyroid, so a very overactive thyroid gland, can cause significant hypertension. But you would tend to get other symptoms with that. You would tend to be not able to sleep. You would tend to be very sweaty. And weight loss would be another significant thing. So an overactive thyroid would be high blood pressure. I think somebody else had also mentioned what figures are concerning in regard to low blood pressure. So that is age dependent. So often in practice, we would see young women who maybe are coming in who are pregnant with a blood pressure of 98/60. But I would be definitely concerned about that in somebody who was significantly older. So it is really age dependent and symptoms. So you'd mentioned about coming off medication if you've been on high blood pressure. So in my experience, most people need to be on it long term, but if a lot of lifestyle changes are implemented, and I've seen a few patients who have lost a huge amount of weight and their blood pressure has been too low, so we've been able to reduce the medication, and symptoms like that would tend to be very lethargic, lightheaded when we're mobilising around, and that would be an indicator actually your blood pressure might be a bit too low for the medication.
Okay, that's great. And I suppose it is just always really important to speak to a health professional, around, it's not just taking one thing that could be causing the high blood pressure. It is all those medical conditions, and just really, speaking to a health professional so that they can investigate potentially what could be the cause of it.
Absolutely.
That's brilliant. And you mentioned there around, some symptoms of other conditions. Dr. Peace, is there any signs or symptoms of high blood pressure? We had a couple of people who had asked around that maybe had a one-off nosebleed in the middle of the night or headaches. Would those be some signs and symptoms of somebody having high blood pressure, or is there anything else?
Well, to be honest, it's probably fair to say that patients really tend not to experience symptoms, and I think Naoimh was mentioning that as well, people. It's much more often the case that people have their blood pressure checked opportunistically, and it would be a case where they come to to see a doctor, and they'd normally come in for another reason, and maybe it is something that's concerning them, something that's stressing them out. And so that's probably not the ideal time for people to have their blood pressure checked. I would see people who've got extremely high blood pressure within the hospital, and I'm always surprised that they actually don't have symptoms. I think, yes, there's always the possibility that high blood pressure could cause headaches, but it actually tends to be the other way around, where somebody has a headache and then they have their blood pressure measured, and then they find that once their headache is treated and the pain is settled, the blood pressure is perfectly fine and they didn't require any treatment whatsoever. So I do think that there's maybe, I just think it's very unlikely that people will tend to have signs and symptoms. And you mentioned specifically about nosebleeds. I mean, again, we see so many people with such high blood pressure, and they really don't experience nosebleeds. People that have nosebleeds just tend to have a propensity to have a bleeding nose. So, the treatment of that tends to be, to see the standard treatments. And if it's particularly bad, then people have to come to hospital. But you find that when they're concerned about it, it's again a sort of innocent bystander. The person measures their blood pressure. Maybe the person's they're really concerned about the fact that their nose is bleeding. Maybe they don't like the sight of blood, and all of that serves to sort of drive your adrenaline production in your body and push your blood pressure up. That's the sort of fight or flight phenomenon. So my experience is it tends not to cause much, and I think, again, it's one of the sort of take home messages from all of this, that we don't really encounter people, or people don't describe symptoms to us, of having high blood pressure. And that is the insidious nature of it. It's the insidious nature as well. You referred to monitoring high blood pressure. That's the problem. Blood pressure has to be monitored because it doesn't really tell you that it's high. So you have to keep an eye on it. And whether that's through home monitoring or whether that's done by a healthcare professional, then so be it, but it just has to be done that way. Just as an aside, I think it's important to stress the fact that, yes, there are secondary causes for high blood pressure, which I didn't mention, but the secondary causes that we're talking about are actually much more uncommon than what are quoted within the literature. And but we do go looking for them in specific cases. And Naoimh alluded to, resistant hypertension, where people are on 3 or more medications and they're topped out on all of the doses of those. Those are the sorts of people that we would really need to see. The other people then, again, through the NICE guidance, is the younger people, and specifically patients under the age of 40. So I just thought it was important just to add that in as well, so that we don't have, so that there's very clear criteria about this.
Yeah, no, that's great. And you also mentioned, Dr. Peace, there around, because we haven't really touched on it, about stress and worry can cause your blood pressure to go higher. And I suppose that is really important, that, you know, if you are going to get a blood pressure check, to, you know, try not to be rushing about, you know, before you go and, you know, have a little bit of a sit, you know, do even some deep breathing exercises just to try and really relax you, because then it'll give you a more accurate blood pressure reading as well. Because it's not just about what we eat or how much physical activity we're doing. You know, if we are going through stressful situations, you know, that can also cause our blood pressure to be higher. So really important to implement some of those positive coping techniques, you know, like going out for a walk, or, as I say, those breathing exercises to help manage our stress levels so that it doesn't cause high blood pressure as well. And you also mentioned, yes, go on ahead.
Can I just say on a point on that, you know, it's so important for people to understand that, you know, when they have their blood pressure measured and they're under stress, it's really often not high blood pressure. So that's why, you know, where possible, we always would advocate that people have a 24-hour measurement done, so that we really get a true reflection about what their average blood pressure is during the day and at nighttime, you know. And you will often see that people's blood pressure will drop at nighttime because those stresses are gone and they're sleeping. You know, it's actually always a little bit more concerning when they have blood pressure that remains high at night. And that's a whole different webinar. But during the day, you know, people on average will do things. They will go out to parks and they'll run around parks, or they'll do things, they'll get stressed by things. So we expect to see blood pressure going up and down throughout the entire day. And that's why it's important to average this all out, and not to really just say, right, okay, one high blood pressure equals high blood pressure for this individual. So really worth bearing that in mind.
Yeah, absolutely. And I know some people would mention to us, you know, about the white coat syndrome whenever they go in and get the blood pressure check, because they're maybe worried, you know, or wanting the numbers to be all okay. And Naoimh, that maybe is where it comes in around home blood pressure monitoring, you know, and doing maybe those, taking a couple of readings and taking an average there, so that we get a good insight into actually what the blood pressure numbers are. You know, should we be doing home blood pressure monitoring?
Yeah, there's a fair amount of research to suggest that actually it really is very beneficial, and it's now part of the NICE guidance to use it as a diagnosis. And in practice, we have been able to do that over the last 2 years with the help of the chest, heart and stroke team, and it has been really very successful, and a lot of patients have been able to do it really very successfully. Some patients don't like the comfort, and some other patients, very rarely, but 2 patients, the stress of putting the blood pressure cuff on them was worse than coming into us. So suits some, but it definitely suited the majority of patients, and they liked it, and it also gave us a really quick and good reflective blood pressure for them. So yeah, so it's really good. We definitely do see white coat syndrome quite a bit, and even just coming into the practice, it's called white coat hypertension. But we would often get them then to sit for 45 minutes, half an hour to 45 minutes, try and relax, and often it does come down a bit. But then you send them home with a blood pressure monitor, or they buy one from the chemist and or Amazon, and it often is back down to normal. But even those patients then who have had some high readings, we would say, well, let's check it maybe a bit more frequently. But yeah, home blood pressure monitoring is used, particularly during the pandemic. It was used quite a bit. And there is now quite a good amount of evidence to suggest that it is a reasonable way of being able to diagnose hypertension.
Perfect. And in terms of, you know, getting a home monitor and blood pressure monitor, you mentioned there you can get it in your local chemist or even off Amazon. Would it be better in terms of, I know there's some like wrist ones you can get, or you can get the ones like for the cuff on the arm, you know, is there one that's better than the other, or anything that you could recommend for anybody that was considering getting a blood pressure monitor?
So most of them that are sold here in chemists do have the count mark that is reasonable. Most manufacturers have certain recommendations, and some say they need it calibrated, some say don't need calibrated. I suppose I would always err on the side of caution, but if your readings were high or very low in an old machine, they range from huge price difference, 15 up to 70, 80, 90 pounds. But I believe your website, Hannah, has a list of recommendations of what is reasonable and reasonable machines to use. They usually are very good to use. I would use the arm. It doesn't really matter what arm, But if anybody's noticing also a discrepancy in the arm, that would also be something to flag up to a clinician. If that were the case, there shouldn't be a difference in about 15 millimeters of mercury between the left arm or the right arm. So it doesn't really matter what arm. Due to some medical conditions, some patients can't use certain arms, but there shouldn't be a massive difference between both arms.
Great. And you mentioned there about calibration of the monitor. Can you explain that just a wee bit further for everybody that's joined today? What does that mean? And should we be getting our blood pressure monitors calibrated?
Yeah, so most equipment that we would use in practice needs calibrated regularly. So even scales that we would check patients' weight on, we get it calibrated regularly to make sure that they're continuously accurate. Most machines, a bit like ourselves, can malfunction now and again. So it's just to make sure that they're accurate reading. And most of the blood pressure monitors will say how often it needs calibrated, some yearly, some 2 yearly. But I would definitely err on the side of caution if it's not calibrated and if it's no machine to see if the readings are accurate or not.
Yeah, and it's probably still important to still see your GP or a health professional to get it checked by somebody, you know, on a yearly or basis to ensure again that your machine's testing, you know, similarly to what, your home blood pressure monitor is.
Yeah.
Perfect. And you mentioned there around, we do have on our website a home blood pressure monitor and frequently asked questions document. So if anybody is, you know, a wee bit concerned about maybe taking their blood pressure at home or considering buying a blood pressure monitor, there's that little document on there, which we'll also link you to on our follow-up email, but it is also on our website there as well.
The automated, blood pressure monitors aren't suitable for some patients. People who are pregnant, it's not accurate for pregnancy, and also the cuff size depends on the size of the arm. So some monitors you can get larger cuffs for, but the cuff needs to be a particular diameter around the arm to give it accurate. Otherwise, it gives inaccurate blood pressure. So that's also something else to be aware of if people are purchasing.
Brilliant. And I suppose again, if somebody is considering doing this, Naoimh, you know, get them to speak to like the nurse in the GP surgery or the GP themselves, or even the pharmacist, you know, within the chemist as well, to make sure that they're purchasing a suitable machine and cuff and all for themselves.
And there's loads of information online about how to use your own blood pressure monitor, and there's videos you can look at and descriptions about how to do it at home.
Brilliant. Well, we're actually going to play now a little video just about how you can take your blood pressure at home. So I'll let you listen to this and hopefully this will all play for us.
Tubing facing down towards the hand. To begin your blood pressure check, place the cuff on the upper arm with the plastic tubing facing down towards the hand. The cuff should be about 2 centimeters above your elbow to make sure it can detect the artery in your arm just under the. To begin your blood pressure check, place the cuff on the upper arm with the plastic tubing facing down towards the hand. The cuff should be about 2 centimeters above your elbow to make sure it can detect the artery in your arm just under the skin. Rest your arm on a solid surface, such as a table, so it is at the same level as your heart, with the palm of your hand resting up. It is important that you sit still and do not talk during the test, as this can affect the accuracy of the result. During the test, when you are ready, press the start button on the blood pressure monitor. The cuff is pumped up to restrict the blood flow in your arm. This squeezing may feel a bit uncomfortable, but it will only last a few seconds. The pressure in the cuff is then slowly released, and during this time the monitor uses sensors to detect vibrations in your arteries. The pressure in the cuff is recorded at 2 points as the blood flow starts to return to your arm. These measurements are used to give your blood pressure reading. After the test, once the monitor has fully released the pressure and provided a result on the monitor, remove the cuff from your arm. Take 2 or 3 readings, each about 1 to 2 minutes apart. If your first reading is much higher than the next, ignore it and take an extra reading. Once you have 2 to 3 readings, you can work out the average. Keep a record of your measurements and write them down exactly as they appear on screen. Blood pressure is measured in millimeters of mercury, or mmHg. When your blood pressure appears on the screen, you will see a top number and a bottom number. Systolic pressure is the top number. This is the pressure when your heart pumps blood through the arteries and around your body. Diastolic pressure is the bottom number. This is the pressure when your heart is resting in between beats. For example, if your blood pressure is 140/90 or 140/90 mmHg, it means that you have a systolic pressure of 140 mmHg and a diastolic pressure of 90 mmHg. As a general guide, ideal blood pressure is considered to be between 90/60 and 120/80. High blood pressure is considered to be 140/90 or higher, and low blood pressure is considered to be 90/60 or lower. If your average reading is consistently over 140/90, you should get it checked with a health professional, either with the pharmacist, your GP, or at a health check at Northern Ireland Chest, Heart and Stroke.
So hopefully that was beneficial, just to give people a guide in terms of taking their blood pressure at home. And that video, along with the longer version, will also be sent out afterwards in the follow-up email as well. And I suppose just to highlight that is a general guide, as we've been chatting about here today. There are other factors around different health conditions that people have in terms of their medical history to consider. So again, speak to a health professional if you've any specific questions. And you mentioned there, Naoimh, just around, what arm to test it on, and is there a difference? Because we had a question in there about, somebody had heard the left arm is the best arm to use in terms of checking their blood pressure. There's no real difference then, would there be?
There shouldn't be a massive difference. We naturally would usually do the left, but no, there shouldn't be a difference, and there shouldn't be a difference of greater than 15 in both blood pressures. And if there is, that would be more reason to seek advice from your GP.
Okay, perfect. And Dr. Peace, when would a GP refer a client to a consultant cardiologist to potentially get maybe further support?
Hopefully never, but no. There are a few instances, I suppose. I mean, we've mentioned a few of them. When someone's diagnosed with high blood pressure, and there's a clear diagnosis and they're under the age of 40, we should look for secondary causes. And when we do that, we tend to just look specifically around the kidneys and the adrenal glands, that are little glands that sit on top of your kidneys that produce various hormones. And so a lot of the time nowadays we do an MRI scan and look at the blood supply to the kidneys, and we look at the adrenal glands on top. It's actually extremely uncommon to find anything wrong, but nevertheless, the guidelines say that we should do it. When blood pressure is resistant, that's another time at which, as Naoimh had said earlier, that you would think, why is it that these blood pressure tablets are not working? Sometimes people are not taking their tablets, and that's a very difficult problem, and that's a problem in general with society in terms of taking medications and being compliant. But generally, if we're convinced that people are taking their tablets, then we would, we think that they're resistant when they're on at least 3 or more medications, then I think we have to consider referral at that stage. There are other circumstances more acutely where somebody might be in and their blood pressure is exceptionally high. It's maybe above 180/120, and I think in that instance, people should probably be referred. And then the other circumstance really that stands out in my mind is, Naoimh had been saying that there's a holistic approach to high blood pressure, and you would really consider referral if you felt that, somebody, there are people in society who are walking around for years with high blood pressure, and unfortunately their heart has suffered as a consequence of it. It's become weaker. They've developed heart failure. And if there's signs and symptoms of heart failure at that stage, and that's really quite advanced exposure to high blood pressure, and prolonged exposure, then those people need to be referred, in the same way as that if you know, they measured that their kidney function was off, or they had problems with their eyes, as Naoimh mentioned, those people may have to go to different specialist services. But those would be the real sort of big main things. I mean, I don't know if Naoimh has any others that comes to her mind, but those were the big four that I would be thinking of.
Yeah.
Perfect. And Naoimh, just I suppose finally to round up our session today, so baseline, when should people go and see their GP practice about their blood pressure, and is there anywhere else that can get their blood pressure checked as well?
So I would encourage everybody to be aware of their own health, and if they have any concerns, signs or symptoms, or they're worried about the blood pressure, get it checked. Local pharmacists do it. You're doing some workplaces do blood pressure checks. Treatment room nurses and healthcare assistants do blood pressure checks. So get your blood pressure checked. But when we're looking at dealing with high blood pressure, we look at loads of other issues. And not everybody needs treated high blood pressure, depending on what the level. So we would look at risk stratification. So sometimes we have ladies who are 67, 68 with a blood pressure of 150 over 92, may not need to be on medication immediately, for example. They may be able to look at lifestyle. But if we have a gentleman in his 50s who's already diabetic, who's already had a heart attack with a blood pressure of 150 over 94, we will really try and treat that aggressively. So it's not just one figure fits all. It's often patients with high blood pressure are tailored to what their particular needs are and what their medical history is. But anybody has any concerns about their health, get their blood pressure checked. But it's also good just to be aware, and every few years pop in and get your blood pressure checked at pharmacists or any opportunity that you can. Somebody else mentioned about, can blood pressure be controlled solely through lifestyle changes without need of medication? Yes, it can be, and in my experience, some people are able to not need medication. But it's hard. We're creatures of habit. Once we get into the habit of a certain lifestyle, it's hard an effort to change. But I have definitely seen some patients make changes in their lifestyle that has been hugely beneficial for their health, and has changed their blood pressure figures, their waist circumference, their BMI, their blood sugars made a big difference. So lifestyle changes are huge.
Brilliant.
Yeah.
Sorry,
I was going to say, I would second that. With my years of working as a diabetes specialist dietitian, I've seen a number of patients who have made a lot of lifestyle changes and not only came off blood pressure medication, but also their diabetes medication as well. So definitely it's always worth it. And even if you can't do it all, just do whatever you can, make it a new routine, and then make more. As I always say, it's a marathon, not a sprint. So any small change that you can make is still a change in the right direction. So yeah, but they definitely do have an impact.
Absolutely. And it's just, as we're saying there, it's just so important to be aware, get your blood pressure checked so you know where you are, that peace of mind, and it can give you the motivation maybe sometimes to get some of those lifestyle changes made, so that it can prevent then anything happening in the future. And you were saying there, Dr. Peace, about medication, and being on your medication and continually taking it. And it's really important just that we highlight that and go off the advice of your health professional, your GP, around the medication and those lifestyle advice that we've been given today as well in combination. So thank you so much to all our panel members today for all of that really informative information. Is there anything anybody wants to add before we finish up today?
Just one final thing. I mean, I think it's really important for people to understand that when you're treating blood pressure, you're generally not curing it, So, I mean, famously and allegedly, Bill Clinton used to think that if once he got his blood pressure under control, that he could come off his medications. But actually, when you do that, your blood pressure goes back up again, This is in the circumstances where, if we put, weight loss and everything aside, and everybody's been very good. So it's very important to realize that, these medications are treating a problem that tends not to go away. So it's just really important to emphasize that. And the second thing really is that, we frequently, and I'm sure Naoimh and others have had conversations over the years where people can't understand why they're now on a higher dose of a medication, and then they're on another medication, and then they're on another medication. But in actual fact, probably 80% of the people that we treat with high blood pressure require 2 or more medications at their maximum doses to allow to effectively treat their blood pressure. So again, the public and the community have to be patient with us, because it is unfortunately the case that we have to do these things for their best, to their for their best interest.
Yeah, and just popped into my head, should then, people who are on medication, it's still really important for them to get like a yearly checkup, just in case their medication needs reviewed and changed. Dr. White, do you want to follow up on that?
Oh yeah, so we would tend to see patients very regularly at initial diagnosis to get their blood pressure down to a regular level. That might be every 6 to 8 weeks, depending on what the initial level is. 3 monthly, maybe even 6 monthly, and then after that, definitely minimally every year.
Brilliant. Well, thank you so much to all three of you for joining today. I really appreciate you taking your time out of your busy schedules, and that's been so informative for everybody, and hopefully everyone who has joined today has found that really useful in terms of the advice you have given. As I've mentioned throughout the session, if you would like more information, please do visit our website. Here you can sign up to our quarterly newsletter with information about the work that we do as a charity. And as I said, we will be mentioning and following up with an email around some of those support resource links that we have talked about during today's session. And during that as well, we'll also be posting out a feedback survey. So if you could take a few minutes just to let us know your thoughts in today's session, that would be really appreciated. And please do like, share, follow our social media pages. We're literally on all of them: Facebook, Instagram, Twitter, TikTok, all of that. And post about how today's session has either helped you, or please do take a look at some of the information that we put up there in terms of managing not only your blood pressure but trying to keep up with a healthy lifestyle. And the rest of the work that we do. So, and just reminder of those health checks that we have coming up. We're doing free blood pressure checks in the following areas. So Mason, Green Island today, Mason, Morristown on the 7th of June, Ard Shopping Centre in Newton Ards on the 8th of June, Mason the Moy on the 13th of June, and Bloomfield Shopping Centre in Bangor on the 15th of June. All that detail is on our website, and the timings of those as well. So no excuse to not pop in somewhere. Hopefully some of those areas are close by you to get a little blood pressure check so that you do know your numbers. So thank you once again to our panelists, and many thanks to you all for attending. Hopefully you enjoyed the session today and found it beneficial. And as I say, if you do need any further support, please do not hesitate to get in contact with us. So I will now end the session for everybody, and hope everyone has a lovely afternoon in that glorious sunshine. Thank you all.
Thank you. Bye-bye.
Thank you very much.
Bye-bye.
Thanks, Now.